Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, it's Dr. Steve Rasner here on The Lionhearted, and today I want to talk about what I think is probably the most important subject regarding clinical requirements for you to be successful in dentistry. What are they? Well, let's talk about it for a minute. What could you do today? And isn't it worth noting here for a second how cool this is, that in our profession of dentistry, unlike any other profession that I know of, you can tremendously change your level of skill by taking CE courses. As far as I know, if you're a physician, if you're a primary care physician, and things have slowed down over the years, and you want to incorporate new techniques in your practice, you can't just go and start taking weekend courses on cardiac surgery or plastic surgery for that point of view. So, but in dentistry, think about how unique and how fortuitous it is for us that we can become, as GPs, we can become amazing at root canals, at aesthetic dentistry, at orthodontics, or implants and whatnot, without actually being an endodontist, orthodontist, or oral surgeon. It's an amazing, amazing time, and I think you need to take advantage of it. I think if you're listening to me right now on the way to work, and you're really not happy about where you're at in your career, maybe you're 10 years into it, maybe it's longer, and you may even hit what they call hit the wall, and that starts to happen when you restore a great percentage of the patients and hygiene that you met 10 years ago in that practice that you bought or inherited. It starts that source of patients and that source of new work begins to dry up. It's a real fact. I remember it happening to me. And if you only have a very limited skill set, the basic stuff that they teach us in dental school, I think you're in for a road that doesn't have to be that road for you to go down. So if you're listening today, this is what you need to hear. You need to not blame insurance for the downtrend of your practice. You need not to blame the area that you're in. I'm going to tell you, you can fix it. How do I know? Because I fixed it. I set myself up with a skill set that I'm going to talk about in a few seconds that you need to really think about. Do you offer these services? And are you really competent at these services? So what are they? Well, let's talk about what you could be great at. Why not take the next 6 months and become amazed, not 6 months, the next couple years, and train and become amazing in, let's say, endodontics. Well, first of all, I do think that's a skill that you should have. Today, rotary endodontics has totally changed the face of the predictability and the speed at which you can do root canal therapy. But that's not a game changer for your practice, and that's what I'm here to talk about today. What would be a game changer for you? What skill sets would totally start to pay off in a significant way and affect and impact your professional life in a multitude of ways, not just by the amount of case acceptance you're getting for these services you now offer, but in a multitude of other ways that I'm going to talk about. What would that skill set be? What about just be great at aesthetic dentistry? Just go out to the Spear Institute or wherever you're, connected to. Well, the problem with that is, unlike 38 years ago when I started, to me, the bleak truth is there's too many of us that are good at it anymore. Back then, there was way less amount of dentists, a less percentage of dentists willing to train and go out to Spear's office, which I went to 22 times, by the way, combining him and John Coy's. and it was worth it. And yes, you do have to know and incorporate high level of skill in aesthetic dentistry. That's why I offer, by the way, and you should write to me at the contact information we supply in these podcasts. You should write to me for my recommended 2 to 4 year residency, exactly what it is you should take between now and the next, actually it's longer than that, and the next 4 to 6 years. Because you can't take the things I'm talking about, a lot of them, and master them, certainly not aesthetics, in a year's time. So let's get to the skills, because I want you to hear about them before you get in the door where you're going today. What are they and why? The skills are, number 1, oral sedation. Put the CD back in. Don't pause it. I'm going to tell you why. Number 1, you've never heard my cocktail of oral sedation, and that cocktail is triazolam, like many others, 0.25. It's 50 milligrams of Atarax. Why Atarax? Because Atarax has an anti-anxiety component to it that a lot of people do not know about. And the last one is Benadryl, because it promotes sleep, makes you sleepy. And it's 25 milligrams of that. And I'll send you the protocol. I don't want to spell it all out in this particular podcast, but I will say this. I've used it for 22 years. I've never had one incident. I want you to think about that for a second. I've done a lot of procedures. I had to call 911 once because I packed cord on a patient that had too much epi in it, and a patient had a tachycardia while I'm working on him. I never had to call a patient, not one time. 911. Not one time in the 22 plus years I've used that particular cocktail. Now, all the details about it, who do I work on, who do I not work on, which there's not many limitations. How long does it last? All those things we will get to in later podcast. But in the meantime, anything I talk about, you can write to me or my assistant Beth, and we'll mail it out within a day or two. The details, everything you need to know from A to Z. So here's the thing. The beautiful thing about oral sedation is there is no learning curve in it. Everything else we do, there's a learning curve. So what I mean by that is the first time you administer the drug packet that I'm going to recommend, you're as good as I am, having done it 22 years. What else could you say that's like that? Certainly nothing else. Not implant dentistry, not the other specialties that we try to incorporate in our practice. So that's a beautiful thing. All you have to do is follow a safe protocol, and there's no learning curve to this. Number 2, it's profoundly effective. It is beyond belief effective. And let me tell you what I mean by that. What I mean by that is that I recently went to a residency in Alabama. I can't think of the name of it right this second. I go around the country and I help all kinds of situations, teach all kinds of situations. And that was I think 18 men and women in a residency program. And they IV sedated a patient for me to work on. I'm telling you right now, and it was cool that they're IV sedated, and we IV sedate people in my practice. My oral sedation patients were easier to work on than that patient was. Flat out true. And I can't look at you and tell you that it works 100% of the time, but it's pretty darn close. I'm telling you, it's pretty darn close. And what does it mean? It means they're going to come into your office 90 minutes after they take it, and they are snoring. They're almost purring in terms of the snore that I'm talking about. So there's so many benefits to this, but the greatest one is this. You may not know this, but one of the strongest factors that contribute to your case acceptance, and when I say case acceptance, I mean a patient that says yes to your recommendations and pays for your recommendation. I don't mean case acceptance where they say, oh, that's a great idea. I'm going to do that first thing in January. That's not case acceptance in my world. Okay, so the greatest impact to that moment when you're chairside in a room with them, we're going to go into amazing detail of every single aspect of this practice that I've run for 38 years that has led to what a lot of people think are extraordinary levels of success and reaching the ceiling of what you can reach as a GP. Whether that's fact, I don't know. I can tell you this, it's a pretty darn good practice, and it is for a very long time. And part of that comes from case acceptance, and part of the case acceptance comes from not from fancy educational tools I have in the room and a fancy consultation room, not at all. First of all, I'm doing my consultations and recommendations right in the operatory. And I would go into that at a later time. I highly recommend that you do the same thing. I'm telling you, do not do your examinations in your operatory and then get the patient up out of the chair, walk into this other room that's been designed to look amazing and has marble and a fancy desk, and you know what I'm talking about. You probably paid a lot of money if you're listening. And some of you can obviously relate to that kind of a room. I'm telling you, it's a mistake. Why? Because I think it's manipulative, and I think you lose a certain percentage of your patients that sense that this is a manipulation. Why are they getting out of the operatory? Why are they going into another room to talk money? And it makes, and to me, it inherently makes, I think, your patients defensive. And you don't want to be that. You want to be the person, you want to be, as a clinician, also a person that they can trust, that they want to do the treatment with because they have a sense, a great sense and confidence in your skills, but that they trust you. They trust you in the fees. That maybe your fees are high, but you're worth it for those fees. My fees are very high, and I'm fine with it. I'll never be able to calculate the amount of money I spent on education to be able to provide the services I provide. You got to make a decision, guys, at some point. What do you want to be? You know, when I have these podcasts, I could go off in 100 different angles because they resonate to me, different thoughts. Like I'm saying right now, you got to decide what you want to be. Do you want to attract patients because you're inexpensive? Do you want to be the dollar store of dentistry? I wouldn't want to be that under any circumstances. And I believe the people that have known myself for a very long time, I've been doing this 20 years, the speaking thing, know that that's not what I advocate. I mean, if that's what you're going to do, then you're listening to the wrong podcast. Because I say you can have an upscale fee-for-service practice. When I say upscale, I don't mean that your building and your plant, your physical plant, has to be fancy. I don't mean that. What I mean is that you're upscale by your methodology you offer, by to some degree for sure, the equipment in your office, digital, obviously digital x-rays, and you're upscale by the staff that you put together. And you're upscale in your protocols, the things that run your office. That's what I mean when I say that to you. You give a long new patient examination, for example. It's not a 15-minute thing you sandwich in between having lunch because you see 40 new patients a week. That is not where my blueprint is coming from, not a little bit. So I'm off the track. Sorry about that. I'm going to do that a lot. But you have to decide who you want to be and what you want to be. And I'm living proof that you can be really proud of the work you do and spend a lot of time with each patient and get these patients to refer other patients again and again. But I know I'm off the track, so why am I saying that? I'm saying that because one of the things that patients are going to detect when they come back to you is that you're very confident and positive that you're going to be able to put them to sleep. I had a guy today, I swear on my life. I had a guy in my office today, missing number 24. I had two patients today. One had never been to a dentist. Two new patients. One had never been to a dentist. He's 33 years old. The other patient was 52, and he had been to a dentist, but not in 20 years. Missing a central incisor, other dental issues. And the second guy that I'm referring to was really uptight, like he was making white knuckles with his hands while I was talking to him. And I totally had him relaxed in a matter, I can't give you the time, like 3 minutes, because it was so apparent that I was so confident, which I am, you will be, because it works not 50% of the time. It works almost every time. I mean, when I say almost every time, maybe once or twice a year, and I don't think it's happened in the last year or the last couple years. I'm telling you, I don't remember the last time, but there have been a couple times in my career where I had to say, look, I think you'd be better with IV sedation. But I really can't think of many of those. Okay. And you're going to know that. So, what happens when you have a patient for the first time you do this and they give you accolades. Oh my God, doctor, it was just like you said it was going to be. And then here's the other thing that's going to happen from this. It's a powerful, powerful source of patients to refer to you. And I know that you hear this in a myriad of other ways of things that you can do in dentistry. Get a CAD cam. And I'm not against a CAD cam and making crowns in your office in one day. I think that's fine technology if you can afford it. There's nothing you could do, Zippo, 100% I'm positive, to get a patient to refer to you more, a new patient, than to not hurt them, give them a pleasant experience, give them good dental care, to a patient who's had a history of problems with receiving that. It is unbelievably powerful. I use the analogy when I'm lecturing that to me, and I absolutely believe this, it reminds me of women that use infertility specialists. Because I lived that life with my ex-wife. So I remember what it was like. Think about it for a minute. That's a powerful emotion. You're in your mid to late 30s. You haven't been able to conceive. And here's what happens. You hear about an infertility specialist at the Mayo Clinic in Cleveland. You're in Philadelphia like I am. You'll go out there, man. You won't even hesitate for New York Second because somebody's wife got pregnant by going to that doctor where they had failed before with several other doctors. And that is such a powerful emotion and vibe that you won't hesitate to find the money or make the travel, miss work, and go out there. You will do it. And you know what happens in that world of infertility? Sometimes you go out to Ohio and it doesn't work. And you're not even like really mad. Maybe you got a little closer to the process. But when you're out there, you heard about a guy in Florida. Now he's a little bit more. And here's my point. My point is that these people that will come to you have tried they've gone to another dentist who may have given them 10 milligrams of Valium. That doctor called that sedation, and it is sedation. Others have gone and had whatever combination they had. I can only tell you this. I was fortunate to have a mentor turn me on to the combination I've given you. It is one of the strongest practice management and advantages I've ever stumbled upon, and I mean unequivocally, in 38 years. I've tried many other combinations. And by the way, you have to use nitrous oxide also in combination with what I said earlier. And I go into all the detail on that when you ask me to send you my blog and my instructions on oral sedation protocol. So the patients are going to sense that and they're going to tell other people because you are going to be successful. But now we need to extrapolate a little bit. So remember, this podcast is about what 3 skills do you have to have and why out of all the other skills that are on the table as a general dentist. So the one I'm advocating is oral sedation. And in terms of, I should say all this now, the requirements depend on what state you're in. Most of you, all of you have to call your state board of dentistry and simply find out what are the requirements. In the state of New Jersey, it's 60 hours of education as a prep to get your license, and then it's 20 hours every 2 years. That's what it is for us. And I think you're going to find that in many other states. Some states will have you train for an IV license, which obviously entails much more training. But I will say this to you. Even though you're just going to dispense oral medications, they'll still ask you to get a IV sedation permit. I don't care if that became the requirement in New Jersey. That's what I would do. There is no other skill, no more important skill that I offer that impacts my practice more than the oral sedation. Because what it's going to do is, number one, and we'll talk about this in a later podcast under marketing, is that you can market the heck out of it. I don't know how you can market the heck anymore in 2018, 2019. I don't know how you can really market aesthetic dentistry to, when I say market, and I don't know how you can do that, I mean to make your phone ring off the hook. You know, if you guys put in tomorrow, free dental care for the rest of the year, yeah, that'll work. But short of that, other than oral sedation, I don't know what else you can really market that can have such a powerful effect. Because the people, let me give you an example. Let's say you did the best aesthetic case you ever did this year. The person that spent the $20,000 with you, that you gave the beautiful smile to, chances are that they don't want to tell everybody they had their teeth done. Because people are saying they look good and noticing that they look a little different. So there's a good chance that they're just being human beings and want to protect themselves and not tell everybody. Now, surely there are some people that'll go out and say, oh, go to Dr. Steve Rasner. He did my teeth. I get that. But a lot of people won't even do it for that reason. But when you take the universal concept of a patient that's fearful of the dentist, and we all know that in every worldwide, that's a phenomena. It's a joke almost that we're dentists. Oh my God, I'd rather have a baby. I get it. When you take a patient like this, who was always worried and always went to a dentist that didn't have that skill, and then you conquer them in one visit, because you're going to, they tell everybody. And I have to tell you something. It's what's carried this practice. Now, it's beyond the scope of this particular podcast because I'm trying to keep these to 30 minutes. But I will say this to you. If you're going to do oral sedation, then you have to learn extractions. And if you're going to learn extractions, you have to learn atraumatic extractions, meaning leaving the same 5 walls of bone that were there when you started the extraction. This world that I'm asking you to consider in your practice, the world of oral sedation, atraumatic extraction dentistry, and then implant dentistry, is so encompassing. I have to tell you, unless you just are so turned off, and maybe you are, by blood and that arena of care each day, it has made me and everybody that I know that's in this arena so much of a better doctor, because it forces you, just by the virtue of wanting to be good at what you do, by wanting to be good at taking teeth out, you have to know about bone. By wanting to be good at taking teeth out, you have to know about bone grafting. You just can't perform it and not know these things. And it's a evolution as you go through this. See, you can't bring the patient in that's fearful, that came into you because they're fearful, and then turn around and send them to the oral surgeon or somebody else. Okay, that's the whole point. And if you're going to go through the levels of training, and by the way, you can learn to take teeth out in a pretty brief amount of time. I give a course in my office. You should check with Beth or myself the details of the course. It's given several times a year. If you're going to learn to do that, then innately you're going to have to learn about bone grafting. And if you're going to learn about bone grafting, then that takes us to the next final triad of the 3 skills: oral sedation, atraumatic extractions, and then the last one would be implant dentistry. And implant dentistry is simply a lifetime commitment to training for implant dentistry. The half-life, for example, on the information that you may receive in 2018 and this year, some of it will change. Well, the half-life's 2 years, they say. So there'll be different ways and maybe better ways by 2020 of some aspects of implant dentistry. There are so many components to go into on that. Soft tissue importance, which is critical. When do you load? When do you not load? Everything. What area, what arena of, what part of the mouth are you working in? That is a whole nother science, but it is fun and it is worth it. Look, I'm going to end with this. So it's Thursday today. I'm in the middle of August of 2018. And, you know, it's the dead of summer. I'm in New Jersey. And we had a pretty darn good week. I pushed $100,000 again. When I say that, I mean in collections. And when you get to know me over these podcasts, the only reason I'm telling you that is because I want you, even to me, it sounds amazing. It does. It's not, I got to make it clear. I'm not booked up with a line out my door, 2 blocks long. I come in and my schedules are filled for sure for a few weeks in advance. But I don't get that many new patients. So I don't really know how that all happens, but it does. It happens almost week after week. And think about it. I'm not doing 1 million patients a week. I'm not doing 10 patients a day. I primarily take care of about 3 to 4 major cases per day. They could be an hour and a half, they could be 4 hours or 5 hours. And 80% of them or more are sedated. Those services include extractions, bone grafting, implant dentistry, soft tissue care, connective tissue grafts, sinus lifts, free gingival grafts. That's a big part of implant dentistry. And there's so many pioneers out there that have taught me the best possible techniques, and I'm going to give them all to you. These podcasts are about you, and you're going to have to listen to a lot of them because there's just too much to say. They're about you having the opportunity to do what this guy did. Listen, I graduated many, many years ago, and I'm sure I'll say this over and over again, 38 years ago. And I wasn't not a guy at the top of my game when it comes to self-esteem. I wasn't. I just wasn't. And the way I got here, the guy that has this amazing practice, and believe me, it blows me away that a lot of people know who Steve Rasner is all over the country, and I've written articles, I've been in magazines. All that is as unexpected to me as anybody you'll ever meet. I'm not kidding. I'm really that guy that worked really, really hard to get through dental school, and it seemed everybody was smarter than me. Still seems like that. But I took a lot of courses, and I took some of them over and over again. And look, if you're a dentist, then you can do what I did. You will learn. Maybe you don't learn it as quick as the top guy in the class that was in your class. I don't know. I can tell you this, it's worth it. Because, and it's not about the money. Yes, it's important to be profitable. I get it. You don't have to even gross what I gross. It doesn't even matter. What matters is that you end, most of my 4-day week, it's a Thursday, I'm done for the weekend. What matters is that you look back, and I did some amazing things this week. I can't remember them all, but I'm talking bone augmentation, horizontal bone augmentation with tenting screws and 100% autogenous bone, and being able to harvest that bone from the patients. I did in one day. I remember on one day this week, I did that type of procedure I just mentioned. I did a connective tissue graft, a free gingival graft, a root canal, and crown and bridge in one day. You think I'm bored a little bit? Mm-mm. And I'm not telling you that because I think I'm anybody great. I'm telling you that I'm the hardest critic on myself of anybody I'll ever meet. I'm telling you this because I know you can be just like this if you have the passion and the discipline and the will. You can do it. And I'm doing it in a very challenged area of America like some of you. So keep listening to the Lionhearted, those that won't quit, those that aspire to what we all dreamed about many years ago, that fee-for-service practice. Thank you very much for joining me this week. See you soon.